So when we think about elbow instability, we often talk about overuse injuries in throwing athletes. That kind of is the sexy stuff. But the reality is that this occurs also in people who have subluxations or dislocations, maybe on the weekends, and also in complex instability with fracture dislocations, as you just saw. So it's not just the throwing athletes. You heard about our techniques for surgical treatment for these types of injuries. We've heard about repair and repair with augmentation with internal brace, and now we'll talk about reconstruction. So who really is the ideal candidate for reconstruction? That is somebody who has a non-acute or a chronic injury, a mid-substance tear with typically poor ligament quality, and then a high-demand patient, maybe a high-level pitcher, but it might also be somebody else who's high-level in another sport. And this is just an example of the kind of patient that we're talking about, this 32-year-old man who dislocated his elbow playing basketball. Pre-reduction here. Post-reduction, you see the joint actually looks pretty good, pretty stable. But 9 months, the elbow feels loose. You can see some calcification around the MCL. And with valgus stress, it opens. And then with the MR arthrogram, we see the disruption of the ligament and the opening here. So that's the kind of patient that we're talking about is a good patient for UCL reconstruction. You heard a little bit about the history. I didn't have the opportunity to work with Frank Joe, but many of those, including Paul, did. But the first procedure was described in 1974 for Tommy John, where he asked him to make something up because there really wasn't a procedure. Interestingly, he got to meet and see Tommy John later in his career. He actually was the manager of Bridgeport Bluefish in Connecticut, so he has some connection to Connecticut